This is Dr. Epstein. I'm with a very kind patient who was nice enough to let me film him. He's approximately 2 weeks out from a revision rhinoplasty. So he's still early, still somewhat excuse me, swollen, but he looks really quite impressive, especially given how he presented to me. He had a prior rhinoplasty, results with which he was quite unhappy. Let me show you some of his concerns. Let's look at the profile first. He had a overprojected dorsum, a lack of tip support. When he smiled, his tip drooped. He had this rounded look, what's called partially a polybeak, but also the whole area was full. Then we look at the frontal view, had a collapse completely of that whole left nostril region. His nose was crooked over to the right, a lot of asymmetries. Basically a nice challenging case with a lot of areas for which we can make some improvements. Here he is today. Let's look at the frontal view. He's happy. Let's look at the frontal. You can see the before. This is where he lacked tip. Now you can go ahead and he's got a much better support. Nice symmetry, relatively even. As I said, he's still early. This was reconstructed with some ear cartilage, and then we can see on the profile, you can see the before, and now is after, just the opposite ratio. Now his dorsum, his profile's been taken down, his tip's nice and defined. Smile for me. See how it doesn't droop anymore? It used to droop. Now the tip stays nice and supported. The way I was able to achieve that was by the use of whatever residual cartilage he had from his septum. And I was able to, if you show that, I was able to basically do what's the technique called the caudal septal extension graft, which stabilizes the tip using ear cartilage as well as some in here, resetting of the bridge and everything else using all the available tissue that we had. He's doing very well, obviously. These are nice cases. Revision rhinoplasty, which is always challenging, especially in someone that's had some of his septum already excised. I typically find that when patients have had their first rhinoplasty done by an ENT surgeon, they're actually more difficult because many times ENT surgeons will take out some of the septum. Generally, plastic surgeons are less likely to use septum cartilage from the septum, so I have that available. But even in those cases where a septum has been harvested, I'm able to use ear cartilage like I did with this patient, and he has no problems, with any deformity or anything of the ear, because the ear is healed up normally as well. Anyway, this is Dr. Epstein showing the after result, relatively early after result of revision rhinoplasty. And thank you, my patient, and thank you very much.